Welcome everyone. I'm Kristin Baird, and I'm delighted to introduce and have Dr. Keith Mausner with us today. Dr. Mausner is one of our physician coaches here at the Baird Group, and so I'm delighted to have him here and find out really what is it that makes him so passionate about the kind of work that he does. Welcome.
Thanks, Chris. It's really great to chat with you today. I love the practice of medicine, and most of us do, but in today's busy and often overwhelming practice environment, it's really easy to lose track or lose sight of certain principles and skills that can make a major difference in our patients' experiences. And I think that spills over into how we all feel about our careers. And I think that underlies much of the burnout that so many providers experience today. I practiced emergency medicine for 25 years in high volume, high acuity departments. And then about 7 years ago, I suddenly became a patient with a diagnosis of cancer. I'm doing well now. I'm cancer-free, but my experiences as a patient really had a profound impact and gave me a perspective on what it's like to be on both sides of the stethoscope. Yeah. I love working with providers to help them improve their patient experiences and also to help them improve how they feel about their careers. I also really enjoy coaching and working and learning with colleagues to just take the time to focus on what is such a vital part of what we all do as healthcare providers.
You mentioned coaching. Tell me about what it is that you enjoy about the shadow coaching work.
Chris, I think shadow coaching is an ideal way to tailor the Baird approach to the individual needs of our physician and other provider clients. We have classroom didactics where we teach skills and a framework to approach patient encounters, but it's the coaching environment, which is in the clinical workplace, where you can really put those skills to use. It's just about impossible, or certainly very difficult, to be aware of all the aspects of your speech, your timing, your body language, and other factors that can influence a patient's experience or how they perceive you.
What I'm hearing you say is it really personalizes it. It takes the education, and then once you're one-on-one, you're able to really personalize the feedback that, okay, we had the theory, but now here's what I'm seeing, and here's what would help you improve.
Yeah, having an objective observer can just provide invaluable feedback. And what an opportunity to do that. The way we do our coaching, it's really divided into two components. Mm-hmm. There's an observation component, which is as minimally obtrusive as possible, and then a discussion component, which is one-on-one, it's private, it's confidential, it's personal, and it's non-judgmental.
Yeah, that's the key, non-judgmental and being able to give that objective feedback. The other thing that I find that comes into play in shadow coaching that I've observed is that so often the provider is so focused on, the information that has to be imparted and talking to the patient that sometimes they aren't reading the room. And as a shadow coach, that's something that I have found to be really valuable, where I see that the provider might miss a cue, that there might be a patient cue that was given that was an opportunity to delve a little deeper or to pick up on an emotion, or you might pick up on a cue from a family member. Do you find the same thing?
Yeah, I couldn't agree with you more, Chris. I think as you're engaging this, you have a chance to see some common behaviors and pitfalls that you see.
Yeah, and what are some of the ones you pick up most often?
Well, one of the major ones is just a loss of focus. As you're going from one patient encounter to the next, it's really easy to still have your mind on that previous encounter, or what do I need to accomplish before the end of the day, or what do I need to do tomorrow? And sometimes just a simple reminder that you are there right then for that patient, and that's where your focus needs to be. And sometimes that lack of focus can really manifest itself as kind of a distracted or disengaged behavior. And very often this is very subconscious, and you see providers, when that is pointed out to them, really profoundly having an insight into some of the aspects of their interactions with patients. Another common pitfall that I see is providers coming in and actually paying more attention to the electronic medical record than to the patient.
You had a funny line about that.
Yeah. That very often today, the patient is getting in the way of the doctor-computer interaction. And I saw that as a patient quite a bit. And very often, some of my doctors were colleagues of mine who are the most wonderful providers. But it's really hard today to not be drawn to that electronic medical record.
It's a huge distraction.
It is a huge distraction.
And you've brought up in our conversations in the past the need for mindfulness. And you kind of touched on that as you were talking about the distraction. Say a little bit about some of your beliefs about mindfulness in medicine.
Yeah. Well, mindfulness has become kind of a watchword that in some way it's used so often that I think people start to apply it to everything. But in relation to medicine, I view mindfulness as singularly remaining focused on what your task is at the time that you're doing it, but also having situational awareness of what's going on and realizing what distractions are important to respond to and when. For example, when you're in a busy emergency department, there are just so many distractions. You might be pulled out any moment because of a resuscitation coming in. But if you're truly focused and mindful of the needs of that patient, that you're picking up on their cues, they'll be understanding of that. And they will really appreciate that interaction that you have. And you can form a really significant relationship with the patient in a very short period of time.
I really appreciate what you're saying here, because there are times, especially when I'm talking with emergency department physicians, where there's pushback. It's like, we're very busy, we don't have time to sit down, we don't have time to really interact for long periods of time. Say a little bit about the quality versus the quantity.
Yeah, absolutely. You could spend hours and hours with a patient and still have an ineffective interaction. It's applying certain basic principles of how you engage with that patient that can make the difference, that you can form that relationship and that bond in a short period of time. Healthcare settings are very often the most intense experiences that any patient will have in their life. And your focus on their needs and their concerns and their families' needs and concerns can have a profound, even lifelong impact on people.
Yeah, absolutely.
Yeah.
You had started to mention whether we're talking about hospitalists or emergency department physicians, some of the common things that you see as prevalent coaching opportunities are the being distracted and the medical record.
Right.
What else do you see that is common in the coaching experiences that you have?
Well, there are certain things that you can do to set yourself up for success in respect to your patient interactions. One of them is, from the very beginning, even the layout of a patient room, that there's a chair, being conscious of where the patient is, where their family is, that you're at their eye level, that you're not engaging in intimidating postures or just even standing above a patient. Those small, subtle things seem very basic, but in today's practice environment and how busy we are, even the most experienced provider can inadvertently engage in those practices.
I've gotten a glimpse of some of the common pitfalls, if you will, that providers can slip into that you identify when you're coaching. Are there other opportunities that are somewhat consistent with providers, or that you would want them to say, hey, these are things everybody can focus on?
Yeah. Well, first of all, one of the most overlooked aspects of our practice is that the patient's experience and their family's experience is really at the core of what we do as physicians and providers. And no matter what our medical knowledge or our technical skill, if we're not mindful of how that patient is experiencing their care, we really can't be as effective as we want to be in our practice.
You mentioned mindfulness, but if you distill it down, that provider-patient partnership, what are some of the elements that you see as most essential?
Yeah, I think some of the most important elements are what we actually refer to as 4 best practices. And these are engaging with your patient, demonstrating empathy, using proven and effective communication skills, and showing respect. I find that incorporating these practices will significantly improve your patient's experiences. And if you do this, you're more likely to have a long and fulfilling medical career.
I think that's so key, that we focus so much on the patient experience that I'm really delighted to see you bring it back to a fulfilling medical career. I think that that's a message for everybody who works in healthcare, that it's not just the right thing to do for our patients. It's getting back to our own connection to purpose. It's why we chose to work in healthcare.
Yeah.
And when we see that patient engaged, when we see them becoming a partner in their care, it makes our lives so much, our work, our lives more fulfilling.
Oh, I couldn't agree more with you, Chris. When a major reason that most of us went into medicine was because we want to help people and we want to feel good about what we do and staying mission focused. And I think focusing on patient experience is a way to stay mission focused and to bring things into the center of what is our purpose here. Yeah, we have all this knowledge, we have all these skills, but we want to be effective in employing them. And we want to feel good about what we want to do, what we do.
At the end of the day.
At the end of the day.
Yeah. We've talked a lot about the coaching aspects, but in the classroom, the didactic component, one of the things that I appreciate about having that time in the classroom with the providers is to be able to drill down into the why behind the patient experience. Why is this important?
Yeah, that is so vital. When you truly engage with your patients, when you're truly empathetic and you communicate well and you show respect, our 4 best practice principles, you are much more likely to form a meaningful relationship with your patient, which builds trust. And that leads to better patient outcomes. People are more likely to be compliant. And for other reasons that maybe aren't so clearly understood, people have better outcomes. And another very positive byproduct of this is that you are much less likely to be sued. And people are much less likely to harbor ill feelings towards you or your institution if they have a positive patient experience.
Yeah, people don't sue people they really like. And
Yeah.
if you take the time to engage, demonstrate empathy, and communicate, you're much more likely to have a positive relationship.
Yeah. And one of the things I like to talk with all providers, I work a lot with EMS as well as physicians and nurses, is that people worry about getting sued or doing the right thing in this way and start second guessing themselves. And really, if you engage in a interactive, positive relationship with your patients, if you do the right things by them, and of course that includes your technical skills and your medical knowledge, but it also includes being focused appropriately on how they are experiencing their care, you are much less likely to be sued. People are going to feel positive about you. They're going to feel positive about your interactions. You know, today people worry about patient satisfaction scores, and they worry about it from the standpoint, and it's realistic, that contracts depend on these things.
Right.
But if you flip it on its head and you say, you know, I've devoted my life to this field because I'm passionate about it, and I care about people. And if you engage in these best practices, these positive patient experiences, these good patient evaluations, and your institution's positive evaluations will come as a byproduct from doing what is right and what makes you feel good about your work as a provider.
So I know that we've kind of talked through this, Keith, but you know, from your vantage point, both as a doctor and as an educator, everybody's looking for the secret sauce. Okay, but what do you see as the best combination or training techniques, teaching, learning, from your vantage point? How can we best help providers to get these skills? From your vantage point, what's the best balance between classroom and practical, hands-on? You mentioned shadow coaching. What do you see as the balance?
Yeah, well, one of the most important things I see is that I don't think you can there is no such thing as a cookie cutter ideal provider. And actually what we want is for people to do the best with their innate skills and their personality, and to just incorporate some, again, basic skills and proven frameworks that can help them optimize their patient interactions. So the didactics provide lots of examples of common pitfalls, common postures, interactions, arrangements, specific interactions that might not go as well, and it's a chance to play those out in your own mind. And then when we take that to the coaching side, which is actual interactions with patients, you get immediate feedback. And the type of feedback we're providing, again, is not to change who you are. It's just to make subtle modifications when you're doing things that might be impeding performing at your best. And when you really distill it down to, for example, our 4 best practice categories, they're very general. I mean, nobody could argue that engaging with the patient is really important. But actually having that tangibly laid out that, yes, I'm going to have an encounter with a patient. I need to engage with that patient. Then you have in your both conscious and subconscious mind an idea of what is that engagement as you're going through that interaction. And what does that mean to me as an individual? Because everybody has their own style. And again, demonstrating empathy. Well, we're all empathetic healthcare providers. We really care. But sometimes, especially when you're in a very rushed or busy or chaotic setting, it's easy to lose sight of the fact that maybe you aren't being the most empathetic that you could be. Okay? Also, proven and effective communication skills, allowing people to finish what they're saying, before you cut them off, or at least allowing them to express themselves before you start micromanaging. I wouldn't even ever micromanage a patient encounter, but at least managing. It's very often necessary to manage a patient interaction. But you get a lot of information if you just allow a person to talk for 2 or 3 minutes. And I think clearly showing respect is very important. It is, I can tell you as a patient, and as a healthcare provider, here I received the majority of my care in my own institution, which I think is one of the most wonderful hospitals anywhere. And I found it really intimidating that when you're all of a sudden dealing with colleagues and you're a patient and you're on that side of it, that can be very intimidating. And you can only imagine when a patient's there who doesn't have the knowledge that you have, that doesn't understand how the system works, that you're showing that person respect And by respect, I mean, yes, respecting who they are, but also respecting their situation and understanding that. And that ties back to empathy. And that ties back to your communication skills. And that ties back to your engagement. The bottom line is if you don't form a relationship with your patients, no matter what setting you work in, whether you're a primary care provider and you see this patient,
Right.
Over many years, or if you're an emergency physician or a hospitalist and you're seeing this patient over a very short, concentrated period of time. I can tell you that sometimes emergency physicians, a patient who is very ill, that patient might be in the emergency department for hours. And you might have a fragmented interaction where you're seeing them for a few moments here, a few moments there, the same as a hospitalist. How you utilize that time, you can form a very deep and profound relationship with that patient that they will never forget. And if that's a positive interaction and a positive experience, they will remember you. And
Forever.
Forever. And
you become part of their life story.
You do.
I mean, how many hospitalizations will one human being have over the course of a lifetime, on average? Of course, we know there are outliers, but,
Right.
but on
Right.
average, how many of those crisis situations, either in the emergency department or being an inpatient, they're not going to be that many. And you have the opportunity to become an important part of that person's life story. And it all comes down to how well you engage with them, how well you communicate with them. Are you respectful?
And when you have that type of interaction with a patient, I've always found that no matter how bad your day was, no matter how rushed, how many hours you were there afterwards, when you have those type of interactions, you can leave that hospital or that clinic that day and say, I really made a difference. I feel good. I can gather up the energy to come back the next day and do that.
And that's so important. I know from whether we're talking nursing or, being a physician, our days are terribly busy, and it's easy at the end of the day to just focus on what I didn't do.
Right.
Rather than, I know I made a difference because.
Right. Right.
And to really walk away with that positive feeling.
Absolutely. And what you brought up about the life story, we all have our life story. And I think it's one of the most profound honors as a healthcare provider to be part of somebody's life story. And making that a positive experience is just priceless. I'll never forget when I was going through my cancer therapy. I was going through chemo. I'd lost my hair, I'd lost a lot of weight, and I had to go to the radiology department to pick up one of my studies. And the clerk there, and I didn't remember or recognize who she was. I was really within myself. And she said to me, Dr. Mausner, I don't know if you remember this, but you took care of my mother several months ago in the emergency department. She was really septic. And I think what you did made a big difference in her surviving. And I just can't tell you how much I appreciate that, and that we've thought about you, and that when I heard you had cancer, that really made a difference. That we knew about that, and that you've done good.
That made your day, I bet.
It did.
Or week.
Because, I was generating my own patient experience. And then to hear from somebody that I was part of their life story in a positive way, that really boosted me and made me feel, this is all worthwhile.
This is all worthwhile, and I'm coming back.
And I'm coming back. Yeah. Absolutely.
Well, that's fabulous. Well, I so appreciate the love and attention that you bring to the profession, and that you're willing to share those gifts with the Baird Group and with the people that we serve. Because, our philosophy has always been, we're here to make healthcare better for patients and the people who serve them. And I think you do a fabulous job with that. So thank you.
Chris, thanks so much. It's really an honor to work with you.